Dr. Steve Price, welcome to President's Club. How you doing?
I'm doing great, thank you.
I want to thank you for taking the time to sit down. I'm really excited about your story. We were just talking a little bit, but 50 years of practicing.
53.
53.
Yeah,
That's amazing.
yeah. Well, I still love it then.
Yeah.
Yeah.
So talk a little bit about, were you at President's Club last year or is this your first year?
I was the President's Club. I was a speaker last year also.
Got it. Okay.
Yeah.
So talk a little bit about what the energy is here at this meeting. And we're really on day 2. We're really kind of officially day 1, but what's it been like?
So I think DCA does a terrific job of really engaging with the docs and energizing everybody. And they're a very forward-thinking company. Think about the technology that we have available to us now that 5 years ago we didn't have. So it's remarkable. They are really pushing the envelope about what's available. And I'm a technology guy, so I brought scanners to my office. You heard Yazzie talk about scanners. We scan every single patient because it's an education tool, and it allows me to talk to somebody in an intelligent way and break it down in a non-dental way. Hey, look at this on the scan. And it's very simple and makes it easier for them to understand what I'm trying to tell them I can help them out with.
So I'd love to focus on the last 5 years, and then I want to go back to when you started dentistry, but you mentioned how technology is changing in dentistry. It certainly has helped you as you're continuing to practice after all these years.
Oh yeah, think about my office is Cosmetic Dental Associates, right? So we do arts and crafts every day. And I joke with my patients, but that's what we do. We change people's lives in the way they feel about themselves, the way they look at themselves, the level of confidence they have in what they do every day. And the technology's changed. When I first started, I joke with patients and I tell them, I fixed George Washington's teeth. That's how long I've been working.
And you're in Virginia.
Yeah. So, but we used to make crowns that had a metal base, and then we baked porcelain on the outside of them. And now crowns are all porcelain. So I can make you a crown that's completely invisible. And I do these large cases where we do 6, 8, 10 crowns across somebody's mouth, or all implants, and they look perfectly natural because of the technology that's available today.
Have you always embraced, like when you look back at your career where, obviously technology has taken a lot of stages, but even 20 years ago, there was newer things back then.
I always did.
Yeah.
I got into implants when they first came out, and I placed my own implants. And now with these CBCT type of x-rays that we have, the three-dimensional x-rays, you can look inside someone's skeletal structures and be able to say, I really have I really have confidence placing the implants in this area, but I really can't do them here. So let's talk about alternatives, And before we had 2-dimensional flat x-rays, you were guessing. So in that regard, I do a lot of guided surgery, which means, especially in a compromised area of the jawbone where you don't have a lot of thickness of the jaw, when you do guided surgery, you literally have a guide that goes over the teeth and it shows you exactly where to place the implants. So your case success is remarkably much better. I do freehand style too, but if you have a compromised case, that's the way to do it.
How have patients changed when you look back over the years of practicing?
So I think patients are much more attuned to what they can look like from years ago. Years ago, we did the necessary stuff that was, well, you got a broken tooth here, we better put a crown on it. Or you have a broken filling here, or you have a small cavity here. Today, we do a lot of work that is optional, but it will make someone feel better about themselves. And so that's where to me, that's where my practice is. I do, endo, root canals and all this kind of stuff, normal stuff. But we also suggest work to patients that they may not have considered in the past. And they're doing it. Years ago, there used to be a secret club called Phi Sigma Ortho, right? No one was allowed to be in that club except orthodontists. Well, now I do ortho. Invisalign allows me as a general doc to do ortho. I won the Invisalign challenge in 2017, the first DSO doc to win it. And it was a special case, but still, it was routine. And now everybody's doing Invisalign. So, of course, the orthodontists are all pissed off at us, but I'm sorry, but we're in the general dentist world. This is what we do.
Yeah, I know in a lot of cases, I mean, I've been in dentistry for 21 plus years in a lot of different areas, but as a patient, I become comfortable with my general dentist. And I know in a lot of cases, if I have to have something done like a root canal or whatever, and they feel comfortable to refer me out, that's fine if that's not what they want to do.
Patients want to be seen by the first person they get comfortable
That's what I wanted to,
And so, you know, I do everything myself. The only thing I don't do is I'll refer wisdom teeth out because they want to be put to sleep. But in my office, when I do large implant cases, I have a general anesthesia, board certified general anesthesia woman that comes in. She does nasal intubations, put the patient to sleep. I do the extractions, place the implants. It's perfect because my patients feel comfortable with me.
Yeah.
They don't want to go someplace else if they don't have to.
Right.
You know?
Well, and you've spent all these years building those relationships with themselves and their families and their friends and all of that. So,
In my office, I mean, it's amazing. I have no turnover. My office manager has been with me 35 years. My 2 hygienists have been with me. I hired one at a hygiene school 20 years ago. So nobody leaves. I mean, it's a family. And that's really, I know what DCA is trying to push here in this conference, but we've been doing that forever.
Yeah.
Because that's how you build a practice. Patients come in, we talk about their families. We talk about their kids going to school, what's going on. And it makes a completely different atmosphere,
Can you talk a little bit about, you've been a part of DCA for a while. I know it's kind of came through some of the other practices you're with and the evolution of DCA.
Right.
What's that been like? I mean, you are someone like you just mentioned that has taken it upon yourself to build your own team, have them stay there, do all these different procedures. So what's been the value of DCA to you?
DCA has been tremendously supportive of me specifically and my practice. Take the technology, all right? I needed iTero scanners, all right? Because I was embracing not just Invisalign, but I was embracing wellness scans. And I have 2 full-time hygienists that have 2 columns each. And we scan all these patients. Well, an iTero scanner is not the least expensive thing in the world. And a CBCT is not the least expensive thing in the world. And so they've been supportive of me tremendously about purchasing this technology, getting the staff trained up. I mean, it's a complete change of how you practice dentistry. And of course, I don't write checks anymore. I don't have to pay employees because they do all the back end work and they support everybody. So to me, it was a major, major positive change. I'm a complete DCA guy. I'm the clinical director up in Virginia, so I'm in charge of, I used to be in charge of like 39 offices. It was a little overwhelming. Now I'm in charge of like 16.
Okay.
And it works a little better because I'm working full time also, trying to run and organize these other practices. So
I think you are a great example to a younger dentist out there, as you know, Steve, that is looking in the industry now, making a decision. Do I join a group like DCA? Do I go to try to build my own practice? I mean, things are obviously a lot different than they were when you started.
Yeah, when I started 100 years ago,
that was it.
We opened our own practice. We had a few guys got together, opened an office. The world is different.
So talk about that. Well,
first of all, young dentists that graduate dental school today are not trained really well enough to actually go out and practice on their own. I mean, I don't want to be critical, and I don't want to be critical of the dental schools because they are really, I think they're doing a great job. But when I graduated, I hit the ground running, you know. And now one of the great aspects of Dental Care Alliance is we have all these mentoring programs. I mean, I have people, before we even hire somebody as a doc, I have them come in my office and shadow me for a week, 2 weeks, because I want them to see how we can do things efficiently.
Yeah.
And, they're not going to do the stuff that I'm doing on day one.
Yep.
But if you have an interest in it, well, let's train you to do this, The young docs are not doing implants the day they graduate. But if you have an interest in learning how to do surgery, how to do socket preservation, so that you're the one placing the implant down the road, that's a completely different world that's opening their doors, opening up to them. And that's what DCA does a great job of.
Yeah.
So
what are you excited about when you look at everything you've accomplished in your career? You've obviously jumped in and done so many things, but when you look out the next couple of years at dentistry, what are you excited about?
Well, if you think about AI and what Overjet has brought to the table, because years ago, I was looking at x-rays, a flat two-dimensional x-ray, and, sometimes it was fuzzy. We were dipping them in solution to develop them. Now, of course, everything's digital.
Yeah.
And now with Overjet, it's not only educational for the practitioner, but for the patient experience. I can literally take a iTero scan. Next to that is my x-ray and say, Mrs. Jones, I want you to see this. And they're looking at it and they understand. Yeah. And so for me to present a case to somebody is so much easier now because it's visually there on the screen.
Yeah.
When you look at an amalgam, I say to Mrs. Jones, there's a huge filling here that's broken, right? They can't see it now because we scan it, we show it to them, we can blow it up. Now, you can do it with an intraoral camera, right? But now I have a whole
if you have that, why not utilize
mouth.
It? Yeah.
Let's do it.
Yeah.
My hygienist, last year, Mediha won the Hygiene of the Year award, okay? And I shouldn't say it this year because she doesn't know yet. My other hygienist, Julie, is winning it this year.
Yeah.
They're the top two hygienists in the entire company. But the reason that they're so very good, they're two completely different individuals, is because they've embraced the technology as well. And I brought lasers to Virginia about 5 years ago. Because in Virginia, you're allowed to do laser therapy, laser bacterial reduction in the hygiene room. And so they're treating cold sores, they're treating, the first thing they do with everybody is reduce the level of bacteria in their mouth by doing the LBR. Well, now it's a standard feature that the hygienists do. And so anything that's new or anything that someone's questioning us about, we have it in the office. Yeah. All the technology is there. And that really is very, very good because the patients, they read about it. They know what's going on.
Yeah. Yeah, I think about, all patients are consumers. And I think about, as the world that we all live in and the expectation we have in the digital space. And that expectation is now spilled over to the dental practice. And to your point, if you're a dental practice that is not embracing these, I feel like it's going to get a lot harder.
I have patients every day that come in and go, nobody ever told me that. Or I've never seen this before. This is so cool because I can look at my teeth on the screen.
Yeah.
It really is remarkably not just educational, but just from a comfort level that the patient has, that I'm not telling them some bogus information, I mean, we've built up trust over the years, but a new patient comes in and they haven't seen this before. Well, I'm coming to you because I was dissatisfied with my other dentist. Well, now I understand, I can see what you're talking about.
Yeah. It's interesting, Steve, when I think about not every dentist, many of them, quite honestly, don't have the years of experience that you do and everything that you and your team did to build up that trust. So I feel like, and please correct me if I'm wrong, that AI has been such an additive to your practice, but a lot of the trust that you built helped with your case acceptance, I'm sure, over the years. A lot of the newer dentists, they don't have that. Like, it's, you know, to build that trust over the years.
It's really unfortunate, but
you know what I'm saying?
I do a lot of case presentations for DCA, and last year my talk in this conference last year at the President's Club was about case acceptance and how you do it. Unfortunately, we're not trained that in dental school.
Right.
And it's funny, I interview docs, and the first thing a doc will do when I'm in the interview process is this. He'll look at his phone. This is the worst thing that's ever happened. They go, I say to him, tell me a little bit about yourself. And they'll go, well, I was blah, blah, blah. I was born. Put your phone away. Look at me in the eye and talk to me, because I'm not looking at your phone.
Yeah.
I don't care what's on your phone. Just talk to me like a regular person and tell me about yourself. And a lot of them can't do that because their communication skills are on cell phones. They text each other. They don't talk to each other. You know, it's remarkable.
Well, it's a good point, and I think it's almost like you've embraced AI, your hygienists and your team have embraced AI. It's there to help, but on the other side of that, I feel like the lesson is even with that technology,
you have to have
there's
a personal touch.
there's still this human connection that a lot of the younger dentists is going to be important for them to focus on. Yeah.
You know, one of the things I do in my world is I coach high school football, and it's a big time program. We have lots of kids that go on to Division I schools, and what we do with them before they actually meet with a coach, we have a mock interview because these kids can't talk.
Yeah, yeah.
And one of the things I tell young docs is, go home, have your spouse in the chair or your son or your daughter, and videotape yourself on your cell phone discussing a crown. And if you think you sound like an idiot, then do it over.
Yeah.
You know, because that's the real you.
Yeah.
You know, if you're doing some weird thing like this, well, maybe you shouldn't be doing that, you know?
Yeah.
And so once you get some feedback from yourself, then you can really understand, maybe I should change my style a little bit, you know?
Yeah. Love it. Steve, thanks so much. This has been great. And I really appreciate you taking the time to, you know, I know the DCA team was really excited to have you. And I think the whole idea of this was to capture all this, speaking of being on video, but really capture, you know, your story and get it out to more of those, you know, in DCA, all in an effort to help them get better and ultimately, you know, help more patients. So,
well, thank you very much.
Yeah, absolutely. Enjoy the rest of the President's Club.
Yeah.
All right. Take care.
Great.